Welcome back to this bonus video with Dr. Elisabeth. I am a board certified optometrist, and today we are going to be looking at TikTokers. There's definitely a lot to learn, what to do and what not to do. So stick around and we'll be talking about what you should do if you have a stye.
How dare I keep you waiting? This was the state of my eye last night. I kept the heat compression thing on for ages, so it got juicy. But again, every time
Okay, so that's a stye. I don't know what that heat compression thing she's using is. People use all sorts of weird stuff like hot tea bags. That's not what I would recommend.
I went to squeeze it, nothing really came out.
Okay, don't squeeze your styes. You run the risk of spreading the infection to the surrounding tissue. If there's not that obvious pimple there, it's not going to come forward. And even if there is, if anybody is going to be doing anything to that stye, it should be done in a sterile environment by a professional, not just pressing it as it seems like she's been doing repeatedly with a Q-tip. She's likely to make the infection worse and just cause more inflammation.
And I didn't want to put too much pressure on, so I went to bed. And then I woke up like this. Crusty eyelid, that is what I woke up with. Jumped in the shower at lava temperatures to apply more heat to the eye.
Okay, a hot shower isn't gonna help you, especially at lava temperatures. You don't wanna hurt yourself. There's a way to apply heat directly to that area in order to help the condition to improve without just exposing your entire body to really hot temperatures. And the temperatures that you're putting on your eye, they shouldn't be excruciating. So I'm gonna talk in a little bit about what you should actually do.
And this is how it looked afterwards. Not bad. It looks like Polly has lost some weight.
She named it. But okay, Polly. Maybe I'll call it Polly from now on.
I also will never be able to put in eye drops.
An eye drop is not going to help the eyelid. That infection is in deep tissue. That's actually treated with an oral antibiotic, if an antibiotic is used at all. I'll talk a little bit about the different treatments that can be used for this in just a little bit too.
It's just something I can't do. From afar, the eye looks good. Up close, there's still something in there. I took Polly for a run by the beach. Now I'm headed home to put on some more heat compression. I want to get this out.
A hordeolum is an infection within a gland of the eyelid by the normal bacteria that live on our skin, on our body. We all have loads of bacteria. That's just a part of our natural flora, but sometimes it finds the opportunity to get inside of a gland and cause an infection. So what I usually encourage patients to do is to do frequent warm compresses, not a tea bag or whatever that was. That almost looks like one of those things that you put in your gloves. Oh my gosh. Like in the winter or when you're skiing. Oh, I hope that's not what that is. Those get really hot. That would not be good. While it's resting there, you can lightly massage the area. You don't want to press too hard. You don't want the heat to cause pain, and you don't want the pressure to cause pain. So I'm glad she said that she stopped applying pressure when it seemed like it was too much. If this is ongoing, you should see your doctor, and a simple oral antibiotic could get rid of it, usually pretty quickly. Please don't do scalding showers, weird types of warm compresses. Resist the urge. Resist the urge to pick at it. Okay, so these people are just wearing multiple colored contact lenses and moving their eyes so that they pop off and somehow making them dance. That's interesting. I don't really know why. I guess just for fun. It goes with the music really well. Oh, well, that's photoshopped. Oh, that's really crazy that she caught that on camera. Basically, she caused a subconjunctival hemorrhage, which is when you break one of the little blood vessels, the tiny capillaries that are are located below the conjunctiva and above the sclera. So when blood gets between those two layers, the sclera and the conjunctiva, you're seeing bright, bright red because the conjunctiva is clear. So it's like having a bruise, but whereas a bruise looks purple or blue because it's beneath your skin, this will look bright red because it's beneath a clear layer. A lot of people get these and they come in really terrified, but it's usually just a broken blood vessel. This can happen from trauma or excess rubbing or anything in the body that increases the pressure. So the Valsalva maneuver, which would be like pushing. So sometimes you'll say to patients like, okay, well, maybe were you lifting weights? Were you constipated? These heal on their own. You kind of just have to wait for it, like a bruise. Okay, that's smart. Oh, okay.
Walking down the street, pretty woman. Kind I'd like to meet, pretty.
So she's made her own saline solution. Okay. I don't approve of this, and I really hope that that water has been boiled or something. But really warm compresses, keeping the area clean, and just waiting it out is usually best. Yikes.
Have you ever gone to the emergency department or urgent care and the doctor takes a look at you and says, oh, everything will be fine, it'll clear up on its own, only for that not to happen? And then
Okay, that's really hard to hear because I know a lot of people have been brushed off by doctors, and when there actually truly is something going on and it turns worse, that's always so disheartening to hear.
and you go see a specialist and they tell you that you have an infection brewing, because that's what's going on with me this week. I saw the eye doctor on Tuesday and she said, basically, I have a stye and the beginning of cellulitis. And so she prescribed me an oral antibiotic as well as like an antibiotic steroid ointment to put on my eye. And on Tuesday, I had like 25% of my eyes showing, so I had some vision. And she said if it got any worse or if I noticed any vision changes to come back. So I'm back because it is Thursday afternoon and I'm not risking going back to the emergency department.
She's absolutely right. Like I was saying earlier, if you have a stye that gets worse, it can turn into cellulitis, which is a deeper infection of the eyelid tissue. And this is a really dangerous area to have an infection, and that can spread. And so if this isn't treated, if this doesn't improve quickly, she's going to need to be on IV antibiotics. So I'm glad that she's following up and everything. The best thing to do is to be established with an eye care provider in your area so that if something like this happens, you can call their emergency line. So if you have something on a night or a weekend, you can get help right away. Some people won't take in patients that aren't their existing patients, and then you would have to go to the emergency room or urgent care or something like that. So definitely better to see an eye care provider if you can. Not to talk down on any ER doctors, but it's just a different level of training that they have.
But you can see, like, I can open my eye, but it just flops right back down because it's super heavy. You can see it kind of like comes down to like a triangle, like a point there, and there is a head on it. So I assume it's going to pop. It's going to be disgusting, but it's going to feel so relieved once it's drained. But part of the reason I'm coming back is, well, first of all, it looks a little bit worse, but also a little bit better. It looks better around here. It's not like red and swollen up here anymore, but everything is accumulated in the center of my eye and underneath my eye and into my cheek. And obviously I can't keep my eye open. And then this morning I was working out and I taped my eyebrow up because I feel fine other than my eye's annoying. So I taped my eyebrow up so I could have like a little bit of vision out of that side. And I noticed that it was really blurry. So anyway, I'm here, hopefully going to avoid.
I hope that blurry vision is from discharge and just kind of being in the way, and that it's not, a deeper infection that's happening. But yeah, she's having swelling around the whole lid and her cheek. I mean, obviously she has a lot of swelling, and as that drains, it'll come down with gravity. But this is definitely a cellulitis, and we just don't want that to become an orbital cellulitis where it starts to affect the eyeball itself. You can lose vision really quickly that way.
An ED trip, and yeah, we'll see what the doctor says.
I wouldn't recommend working out if your eye is in this condition. You're just exposing yourself to more bacteria in the gym environment, or maybe she's working out at home, I don't know. But when you have a big infection like this, it's just better to take it easy.
And holy is painful. I'm sitting there thinking, women go through childbirth, this is going to be fine. I'm fine. The other part of it is that you have to stay dead still.
Oh my God, oh.
Because reminder, there's a huge needle in your eye.
It's been a while since I've seen a Chalazion surgery. Looks a bit painful.
In your eyelid. You don't want to move much.
Find out if I am.
So they're using betadine to clean the area. This is used before all kinds of surgeries, most surgeries, I would say.
That looks like a torture device.
Yeah, don't worry. You won't feel it. If you do, tell me. I'll give you more anesthetic, okay?
Okay.
Okay, well, I think that's enough eyelid stuff for today. I hope you learned something. Above all, go to the eye doctor and resist the urge to poke and prod and push and squeeze at styes. You can really put yourself at risk for spreading infection, causing bigger problems for yourself down the line. So just resist the urge, please. So thanks to these TikTokers for giving us a lot of content to talk about. I hope that next time you have something like this, you will do the right thing and go to the doctor and follow their recommendations, and please stop touching your eyelids. All right, everybody, we'll see you next time.